All right, good afternoon, everybody, and welcome to today's webinar, Run Injury Free in 2017. And before we get started, I'd just like to go over a few items so you know how to participate in today's event. Most likely you're listening in via your computer speaker system. If you prefer to join us over the phone, just select telephone over in the audio panel, and the dial-in information will be there for you, and you can join us that way. So you can submit a question at any time during our webinar by typing your question into the questions pane, and we'll collect the questions and address as many as possible during our Q&A session at the end of the presentation. So let's get some introductions out of the way. First of all, my name is Jim Harding, and I lead the charity running team here at the Mercy Home for Boys and Girls in Chicago. And we run the Bank of America Chicago Marathon every year to provide a safe home, emotional healing, and academic opportunities for children who suffered abuse, neglect, poverty, and abandonment. Our fantastic panelist today is, we're very happy to have aboard Dr. David O'Brien. He's been in private practice since 1981 and is a well-known sports medicine specialist, particularly in the area of running injuries, an interest that began as a cross-country runner back in high school, and we won't give that year. Dr. O'Brien also specializes in foot and ankle surgery and is a consultant to many of the cross-country and track programs in the Chicago area. So welcome, Dr. O'Brien. Glad to have you here.
Thank you, Jim.
All right. So the first question we have is, let's just talk a little bit. It's more not really a question, but let's just talk a little bit about what an overuse injury is.
Well, I think the first thing is to try to distinguish what gets described as overuse from acute injuries, because those are things that people have no trouble figuring out. You've been tackled, you've been hit, you've got this very large sudden trauma with a resultant injury. And so there's not a lot of guesswork as to what happened. Whereas an overuse injury, just as a general sort of concept, that are things that are the end result of a lot of seemingly small factors, that are repetitive. So if you have shin pain or you have heel pain, you usually didn't have some particular incident. You have some imbalance either with your feet or your legs or your running form, and those things have some sort of micro trauma effect, and those things just get repeated over and over until you finally, have some sort of pain. And in almost all of them, we talk about your structural anatomy. How are your feet built? How are your legs built? Do you overpronate? Do you oversupinate? Do you have a limb length discrepancy? An awful lot of people have weakness or inflexibility around the hips. Distance runners in general don't get much information about form and technique, or they may train badly. And so it's usually not just one thing. It's an accumulation of things that running repeats over and over again.
All right. So so what, as you go forward looking at this and a little bit more into one of the most common injuries, which of course is shin splints, also known obviously as medial tibial stress syndrome. So can you just talk a little bit more about the shin splints for us?
Sure. It's something that anybody can have. It's really common in high school runners and college runners. It's that pain you get along the inside of your shin bone, and there's most people refer to it as shin splints. And what it really is inflammation, chronic irritation along that shin bone where all the muscles attach, particularly muscles from the lower half down. And it's a good thing to keep in mind that the muscles in the lower legs all end up in your foot somewhere. And so very often the things that predispose you to shin splints is the chronic or overuse of the muscles that are attached to that bone. They're working longer and harder than they're designed to do. And so you end up with these small microtraumas, these little tears in the muscle or in the tissue that surrounds the muscle. And especially in high school and college runners, it's a very common problem. And it was always my biggest running pain when I was a high school kid.
Right. So let's talk a little bit about the treatment for that then. So when you do get diagnosed with this, obviously, I'm sure you would recommend that somebody call a doctor like yourself and come in and get this looked at and checked and figure out ways to fix that. So what are the ways that you treat the shin splints then?
Well, you go back to what I said about what an overuse injury is. You determine what is the cause. Does this person have a foot structure that is overpronated or oversupinated? Do they have a poor running mechanics? Because and people who tend to take short strides or run with a wide stride or that kind of thing are going to hit the ground with more force, or people who run with their toes out tend to put more stress on the inside. So you want to try to address, and this is true of just about all of these injuries, you want to try to address all of the seemingly small factors that cause their pain. So in shin splints, you have to deal with the pain, and that usually ice and massage and even some heat and ice contrast. Trying to deal with whether or not if they overpronate. I usually start with some temporary taping or padding to support the inside of the foot and the leg. Ultimately, they may need orthotics, but those are usually going to be in conjunction with trying to teach them how to run properly, how to train properly, and shin splints in particular can be a very stubborn kind of an injury.
So you recommend this stretch then that we see here on the screen? This is the one that would really help then, or?
I was just making a point. If you can stretch like that.
All right. So this is a little bit about how to strengthen this injury. You mentioned obviously some things that can be done with taping and other things, but as far as strengthening the area, what do you suggest?
Well, what you see in the picture are band exercises. To strengthen the muscles on the inside of your legs, it's more difficult to do with standard weight training. So this is where resistance bands can be very helpful. Producing resistance to invert your foot against that resistance helps to strengthen the muscles in the lower legs. Also, we refer to what are called eccentric calf stretches, and it differs from the kind of passive stretches that you see, where you're just trying to stretch out your calves, where you're trying to increase muscle length. Eccentric calf stretches involves, very gradually lowering, going up on your toes and then lowering your heels, doing a certain number of repetitions on each side. And it's called an eccentric stretch because you're making those muscles contract as they elongate, and that really helps to build strength, plus the capacity to absorb shock.
All right. Well, let's look at another common problem that runners talk about a lot. They get this lateral knee pain. A lot of us know it as ITB. So, can you tell us a little bit about that injury?
Well, you can, I often describe knee injuries in runners as an innocent bystander phenomenon, because much of the time there has been no direct injury to the knee, and yet, just like shin splints, knee pain is very common in runners. And the reason I say it's an innocent bystander is very often the knee is a fussy joint. It just wants to act as a hinge, but it does have the ability to rotate from side to side. And so if there's a force exerted on it by the lower leg and the foot and the ankle, dragging it, then it causes it to rotate too much in one direction. And then the muscles around the knee compensate to try to stop that. Or if you have weakness or tightness around the hip and low back, again, the muscles around the knees are going to work a little longer and a little harder make up for that, and the pain gets generated by the extra work being done by the muscles that are trying to stabilize your knee. And the more and more, we've looked at limb length discrepancies, but where one hip is higher than the other. And by the way, most of the time that's something that's postural rather than structural. But we're all sort of paying more and more attention to tightness in the hip flexors, because that can tilt your pelvis forward, which makes it much harder to stride properly. And your knees kind of get caught in the middle of this.
So this is one of the reasons that it's very important to go to a professional like yourself. A lot of times people have the idea of, well, I'll just take some time off and I'll put some ice on it and it'll be, or maybe take some anti-inflammatories and everything will be fine. But, for reasons you've mentioned and some others, I'm sure that, you would suggest other options.
Right. And excuse me. And that's not, it's not necessarily a bad, it certainly doesn't do any harm to try, to putting ice on the area or taking anti-inflammatories. But unfortunately, the word overuse sometimes gets used as a diagnosis in and of itself. And so then the suggestion is, well, then just rest. And rest may be one of the things that's necessary in some cases to get over the pain. However, if you have these mechanical issues, and ultimately they do come down to mechanical issues, as soon as you start getting active again, the pain is going to come back. So it's trying to take care of all these little factors that have to be recognized by somebody, a doctor, a coach, somebody who has experience in this can tell you, hopefully, all the things that are causing your pain.
All right, let's move on to another one. Plantar fasciitis. This is you pictured a woman here kind of holding her foot in bed. I think this is one of the ones that people talk about. Oh man, when I get out of bed, my foot really hurts. So talk to us a little bit about what this injury looks like and some of the causes of that.
The plantar fasciitis and heel pain. Believe it or not, when I was in training, the typical term for it was heel spur syndrome, and that's because it's often associated with a heel spur, a spur on the bottom of the heel. And the typical patient was, usually we were told a sedentary, overweight, middle-aged woman. And I think in this day and age, runners in particular are very familiar with heel pain and plantar fasciitis, and are surprised as to why would somebody who's sedentary have this pain. And it's not that running causes everything you have. I tend to think running finds much of what you have, whatever our mechanical faults are. Running tends to find it because it's repetitiveness. So the typical heel pain that people have here is pain on the inside of the heel. You notice it first when you get up in the morning. Oftentimes as you walk, you feel better. Or sometimes people will feel it when they begin to run, and it feels a little better as they go along. But then they may notice again if they sit and get up start walking, or as it progresses, and things can progress over time, they'll find that toward the end of the day it starts to bother them again. And it's really
okay. So one of the treatments for that is this handy little contraption we see here. You're using in your office out there in Roselle. So tell us what EPAT is.
EPAT. Well, before I get to that, I usually do a lot of the same things that we talked about with Shin splints. Usually conservative measures. And when I say conservative, I'm talking about taping, padding, orthotics, stretching, are going to take care of your heel pain. But the longer it's there, the harder it is to get rid of. And in the last 15, 16, 20 years that we have more things to treat chronic pain. And EPAT is referred to as extracorporeal pulse activation therapy, which is a longer name than it ought to be. But it's creating radial sound waves. So if you know anybody who's had kidney stones, and they went and had lithotripsy. They get put up against something that has is basically a shock wave modality to break up all of those little into those stones so that you can pass them. And something like the EPAT or there is a higher frequency shock wave does a similar thing, not quite as dramatic, but you're creating some irritation via sound waves to scarred up tissues. Because when your heel starts to become chronic, it's because your fascia is starting to scar up. And it's not going to respond well to things like cortisone or anti-inflammatories. And the idea behind the EPAT is to instigate a certain amount of inflammation, not so much to cause it to hurt, but to bring little blood vessels to have them start to grow so that you can get growth factors and other things to try and repair that tissue that just can't repair on its own. And this is something that's kind of nice because you can do it in the office. It doesn't require anesthesia. But you have to always try to remind people that it's not an instantaneous sort of treatment. Also, it's something that you've started a healing process that's going to take some time, but the longer it's being used, and particularly in the running population, most of my colleagues in the papers being put out on it are saying that it's really getting to be, and it's going beyond just being the gold standard. It's a very, very effective treatment for plantar fasciitis.
All right. Just going on to the next one here then. So we're going to skip over that a little bit. We're going to move on to talking about shoes. But I do want to make one point here of the three injuries we've talked about. The recurring theme that you obviously hear throughout this is, this isn't something you should try to tackle on your own. That it's you need to be diagnosed. As we mentioned with the knee pain, most times it's not your knee that's a factor, and there's other things involved. So just a reminder again that how important it is to see a professional like Dr. O'Brien when you do start to have these issues as they crop up. And again, don't wait too long, like you said, on the plantar fasciitis. So talk a little bit about the role in shoes and getting the right shoe. We should pick our shoe by what color we like, right?
Absolutely. Not only that, but the color that your friends wear. Because that is actually where most people get their advice is from their friends, which is fine. But and I think the picking shoes has been made more complicated than it ought to be. Because there are shoes that are referred to as motion control and stability and cushion. And in the end, which shoe is going to say that the shoe should fit your foot sounds like one of the dumbest things you could possibly say, but it ends up being probably one of the most important things that you can do, because the different types of shoes have different shapes. You have what's called a straighter lasted shoe, a semi-curved last, and a curved last. And sometimes if people aren't sure, well, what does my foot look like? Stand on a piece of paper and have somebody trace your foot. Because if you have this foot, this is a very pronated foot. It happens to be my youngest daughter, as a matter of fact. And you can see that because she's so pronated, it has caused her to have a very straight sort of a foot from front to back. Well, as it happens, the shoes with the most motion control tend to be straight-lasted shoes. So in this case, it's not she's looking for the motion control shoe because somebody said she needs it. It's because that's the shoe that looks most like her foot. It's shaped most like her foot. And, whereas somebody with the opposite problem, with the very high-arched or supinated or cavus foot type, well, they tend to have a more curved structure to their foot. And as it happens, the shoes that are very light and curved and cushioned are shoes that are appropriate for that particular foot type. And then lastly, you have people that fall in between. They're sometimes stability shoes or neutral shoes, and there's a lot of overlap in that. And that's usually somebody who's in between. You have a mild curve, and there are certainly a lot more shoes in this range. But that's the first thing I think people ought to worry about. And the second thing is the size. And the thing is that shoe sizing is not, that should be the simplest part of picking a shoe. And it's been made very difficult because there isn't a lot of consistency from shoe manufacturer to shoe manufacturer. And so you may know what your shoe size ought to be, and you may pick, and the salesperson may pick you a shoe with that size, and it may not fit you because a size 10 in a Nike is going to be smaller than a size 10 in a New Balance, and so forth. So, I urge people to view the label as a suggestion rather than something that's a hard and fast rule. You have to try that shoe on. You should have about a thumbnail's distance between your longest toe and the end of the shoe. And if you take
so that's another reason. Again, a lot of people have gone to online shopping, and even as you find a shoe that you really like, as they make updates in that shoe, it doesn't necessarily fit exactly the same in that size. So, we've got a couple of great partners, Universal Sole and Fleet Feet, that are here in Chicago, that we always recommend going to someone like that, and actually, again, getting your foot measured to start with is to have a starting point. And they also, a lot of those places now do, as you mentioned earlier, the importance of, what do you look like when you run, and so they'll put you on the treadmill and see how you run, and gives them kind of an idea. They look at your foot. So, just the importance, again, of getting to, especially as you're starting out and getting into running, to get into the right shoe right away, and to have it fitted properly by a professional. So let's talk a little bit about, we've mentioned orthotics a little bit. Why don't you talk a little bit about what orthotics do, who might need them, and just how somebody would go about getting them, because you can buy inserts in the store, but kind of maybe talk a little bit about what an orthotic is compared to an insert you might buy in the store.
Sure, I've used the terms overpronation and oversupination, and people who run have heard these, and sometimes the assumption is, well, if you're pronated, you're just flat-footed, and if you are supinated, you have high-arched feet, and there's a lot of people who fall in between. But if you overpronate and oversupinate, it is mainly because of the structure of your feet, and because our feet are made up of a lot of little bones, and all of those bones are most naturally stable, or line up where they're have most inherent stability in a certain position. And when I was in school, we referred to it as the neutral position. You can think of it as your stable position, but it's largely what you're born with, what you've inherited from mom and dad. And those feet, if that structure doesn't put you parallel with the ground, then you have to unlock those bones as you bear weight and stand. And that's what starts some of this overuse ball rolling. So all an orthotic really is to try to maintain you in the structure in which you are most naturally stable. And in doing that, you're going to reduce the necessity of compensation. And so, a custom orthotic is made from an impression taken of that person's foot. Just like, your eye doctor takes measurements of your eyes and so forth. The over-the-counter inserts, are not necessarily a bad thing, because you may have a mild problem, and that may be all you need, just as people who have slight vision problems can go to Costco or Walgreens and buy reading glasses. But when you go beyond that, then you need something that's more structurally made for you. And that's really what an orthotic does.
All right, so I do want to remind our attendees, if you do have a question, there is a place where you can type a question into the little pane there on your screen. So if you do have a question, feel free to type that in, and we're going to answer those in just a couple of minutes. I want to move on to the next topic here. So talk a little bit about the importance of core and glute strengthening for runners, and why that's important. And some people, I think, myself included, have the tendency to think, I have an hour today, so I should spend that hour running. But talk a little bit about this aspect of things, when you should do it, before or after running, and just how important it is to the runner.
thing about running, and the thing, well, is standing and walking, is that everything from the back on down becomes engaged in this very coordinated movement. And if anything is not operating properly, other things compensate for it. And for years, we've talked about core strengthening, and of course, in this day and age, a lot of, when you talk about core and glute strengthening, people are thinking in terms of, getting six-pack abs and, doing P90X, which is a very good workout. But your core are really, I've come to the conclusion that it's the muscles really in between the knees and the shoulders. They're involved in stability. And, the muscles around your core and your hips are important in order to maintain your upright position and also to help to dissipate and control weight. So when your foot hits the ground, that limb that's on the ground is being well supported by the muscles around the hips, which include the glutes and the hip flexors and so forth, so that as you're moving forward on that foot, you're gliding forward, they're maintaining your stability so that you're working with as much efficiency as possible. So most strengthening exercises you're not going to necessarily do on every day you run, but there are things you will do, several times a week. Most runners are going to do some sort of strength training, whether it's involving glute strengthening, or calf strengthening, or low back strengthening, and that's where core and glutes really come in.
All right, so there's a little bit more about the hip strengthening there. You see folks using the band, of course, in a couple different exercises there. So that's obviously just a way to create a little bit of resistance as you're doing those things. And so as we look at this next slide here with talking about treatment of injuries, one of the very important things that I see on there that you talk about is, flexibility and then, of course, stretching after activity. Can you talk a little bit about, why after and not before, or what you would recommend before? If stretching's not good, what is something good to do before you head out the door, and just the importance of this?
Right. Before activity, it's, sometimes you'll hear bad things about stretching, just as you hear bad things about, some of the strength training, but a lot of it has to do with timing. So it's never a good idea to do any kind of exertion, whatever it is, when you're cold. So before any kind of activity, whether it's running or cycling or strength training, you need to warm up. If that means just walking for a while, if that means getting on an exercise bike or doing jumping jacks, just doing something to get your blood flowing so that when you start to increase the demand on those muscles and joints, they're warmed up and ready to go. The thing is, if your muscles are fatigued, you're going to, as you run or as you work out, generally you feel better because your muscles have blood flow coming to them, and your muscles are usually going to be operating in the proper sequence of contraction and then relaxation and then contraction. And then when you're done running and you're done working out, as you cool down, if those muscles have been fatigued because of overuse and other things, they tend to shorten up more than they ought to. And so that's why sometimes people say, yeah, I feel fine after I run, and then I sit down and I get up and, oh my God, everything hurts. Or like with plantar fasciitis and other things, when you get up in the morning. So trying to work on flexibility is best done after the workout, so that this is when your muscles are warm, and as you're cooling down, the flexibility exercises are really designed to try to help them to get back to their normal resting length, but not to go past that so that you're tightened up. And so it's usually warm up before run, stretching after.
So thanks so much, Dr. O'Brien, so far for all this great information. We're going to answer a couple of questions here that have come in. And our first question, somebody wants to know, they see a lot now with foam rollers, lacrosse balls, different things like that with injuries. So can you talk about the kind of the role of those things that have come more and more into fashion, and when and how people should use those properly?
Yeah, those are actually really wonderful little aids in helping to knead muscles. I was just talking about stretching, but sometimes you need more than stretching when your muscles are sore. You need some physical massaging action, and of course you can go to a professional who does massage. We have that in our office, as you know, Jim. But like using a golf ball or a lacrosse ball or a tennis ball, or a lot of fitness places have the little spiky balls. What those are for are to massage sore and tight muscles, and the same with the foam rollers. The foam rollers give you the ability to massage larger muscle groups like your hamstrings and your quads, or even the muscles around the shoulder and the erectors along your spine. But they're very good at that, providing that muscle therapy that people often need.
And of course, one of the things that it allows you to do is, when you're on your own and you're trying to get at these issues, you can use your body weight to dig in a little deeper than you could perhaps with your hand or something else. So talk a little bit about that. That you need to be careful, of course, not to put too much into it. But where's that happy medium come in?
Well, I think the main thing is let's say that you're using a tennis ball or a lacrosse ball to massage the bottom of the foot, which a lot of times we'll do in people with plantar fasciitis, because the little muscles on the bottom of the foot that go from your toes to the heel get pretty tight. And so using a small ball is a good way to massage those small muscles, but sometimes people mistakenly think they'll get more out of his wrists if they stand on the ball. Well, that's not going to feel so good. Or they won't just crank down on the muscle; they'll be hitting the joints, or the bottom of the heel, or the bottom of the joints in the ball of the foot, where you really don't have muscles at that point, so you can bruise yourself. So it's a matter of keeping the massage tool, whatever it might be, in the muscle element, and you can get into tendon too, or tendon attachment, but you don't want to be really applying that hard on a bony structure, for instance.
All right, one more quick question here we have time for. Somebody wants to know as far as using ice and heat. You see the biofreezes and the old school Ben Gays and things like that. When is it right to use that, and when is ice the proper tool?
Well, I feel heat. What heat does when you use it, aside from feeling nice in the wintertime, is that it brings blood flow to that area. You probably notice I bring up blood flow a lot too, when you have an area that's tighter or sore, first thing in the morning or before workout, using some heat to encourage blood to go to that area, and with that blood flow, those muscles tend to relax a little more, is the proper time to use heat. Ice you should use after activities. People are sometimes tempted to use heat after they've run or after they've done a strength workout, and actually it's after the workout that you should be using ice, because it's a very localized anti-inflammatory, and you're trying to reduce the effects of excessive inflammation after exercise or after physical activity.
All right, so at this time I just want to thank everybody that joined us here on the webinar today. This will be available to you via recording. That will be coming out to you later. I want to remind you that you can find Dr. O'Brien at Weil Foot and Ankle Institute. I know I visited him down in Roselle. Where are your other offices at, Doctor?
The Weil Foot and Ankle Institute has offices all over up north and downtown. I'm exclusively in the Roselle office. The main office.
All right, so you can find him at Weil, W-E-I-L, the number 4, and then feet, feet.com. That's their website. And I wanted to just tell you a little bit more now while we have a second with you here about the Mercy Home Heroes program. you can follow any of the links you see here on this slide. We'd love to have you join our team for 2017. We have 200 spots available for the Chicago Marathon this year, which is sold out. The only way in is through charity, so you can visit our website there. You can email or call me. You can also check out our new hype video, which is pretty cool. And as you see there, we do have more webinars to come. So our next one is scheduled for March. That most likely is going to be focused on getting the right gear, including shoes. We do want to let people know, I know some people were joining this, and we mentioned that we do have a recovery pack, which is valued at $150 that we will be giving away. And I just want you to know that that will be given away at the end of our webinar series. So stay tuned for these other webinars coming forward. You'll definitely get information on those if you were on this one. And after you leave today, also, you'll receive a short survey, and we'd love to get your feedback on that. And again, a follow-up email should be coming with a recording of today's webinar that you can share with other runners and friends, and let them just get some of the knowledge that Dr. O'Brien has provided for us today. So thanks again to everyone, Dr. O'Brien, and our attendees, and just hope everybody has a blessed rest of your day. And thanks again for joining us.